Hello everyone, good day. This is Princess Cassandra Pimentel, a nursing student of National University, NERD 202. And for today's video, I am going to demonstrate the proper ways on how to assess the patient's eyes in eye structures. So, the first thing that we should do is prepare the needed materials. So what we need are the patient's eye assessment chart, a pen of course, cotton tip applicator, a newspaper or magazine, or any reading materials with small prints, an opaque card, a pen light, but since I don't have a pen light yet, I'll be using a small flashlight as an alternative. And you'll also be needing a examination gloves and an alcohol for sanitary purposes. So before the assessment starts, make sure to perform a proper hand hygiene and observe other infection control procedures. And after that, you are now ready to assess the patient's eyes and eye structures. Hi ma'am, good day. My name is Princess Cassandra, a student nurse. Can you please identify yourself for me? Okay, and your birthday please?
November 16, 2009.
Okay. And I see you this month. Verify identity. So your choice is the Pasqua. November 16, 2009. If I check. So, what do you want me to call you? Okay, Charisse. So another question. What language do you prefer to communicate with? Taglish? Okay, so before we do that, let me just close this window to provide you some privacy. How are you feeling today? Okay, so are you comfortable?
Yes.
Or do you want me to adjust the room's temperature? Okay, so today I'll be assessing your eyes. It is for us to know or to detect if there is any eye problems at the earliest stage. So during the conduct of the assessment, I want you to read something, or I will be shining a light on your eye, and of course inspect and palpate your eye structures. Is that okay with you?
Yes.
Okay, good. So before we start, let me just ask you something. Do you have a family history of diabetes or hypertension?
No.
Okay, that's great. How about eye disease, injury, or surgery?
No.
Okay. When is your last time to visit the ophthalmologist to check your eyes out? Last year, last month, last week?
Last one.
Okay, that's great. How about do you use contact lenses or eyeglasses? Okay. How about current symptoms of eye problems? Nakakaramdam po ba kayo ng pananakit sa mata or something? Okay, thank you. So let's start. Let me just perform hand hygiene. So I'm going to assess your eyebrows. Can you move your eyebrows for me? Another? Okay, and your eyelashes. Can you blink? Okay, and your eyelids. Can you close your eyes? Okay, that's good. So I'm also going to check your sclera, or the white part of your eye, and your bulbar conjunctiva. So before I assess you, I'm going to put some hand gloves. So I'm now ready to check your bulbar conjunctiva. Can you open your eyes? Look down. Look up. Okay. Look up and look down. I'm also going to use this to inspect your eyes clearly. Okay. Look up. Okay, now. Okay, how about this? Look up and down. Okay. And after that, I'm going to check your bulbar conjunctiva. So I'm going to shine a light on your eye. Okay. Okay, that's good. And the other. Okay. So palpate your glands in your duct. Those are the ones that produces, control, and drains your tears. So I can palpate it. Just open your eyes, ma'am. Okay. And there's no discharge, no discoloration, and no swelling. That's normal. Okay. So we're done with assessing your eye structures. So now I'm going to assess your vision. So what I'm going to do is, let's see, I'm going to check your peripheral visual fields, your extraocular movements. I'm also going to ask you to read something in a small print to assess your near visual acuity. Okay, then do you understand that?
Yes.
Okay, and then your accommodation test, direct and consensual papillary reaction. Okay? Okay. So the first thing that I'm going to do is check your peripheral visual fields. So just follow this pen. So I'm going to point this out on the farthest peripheral vision of yours and say stop if you see it now. Okay?
Mali.
So okay. And okay. Okay. And now I want you to put your hands on your right eye. Okay. Another. Wait lang. Sige. Can you see it na?
Stop.
Okay, another one. Okay, and this one. And this one.
Stop.
And on your another eye.
Stop.
Okay.
Stop. Stop.
Okay, that's it. And after that, wait, let me just write it. And after that, I'm going to check your extraocular movements. So just follow this pen using your eye, okay? Just follow it. And that's it. So the findings are okay. And then I want you to read this newspaper. Can you read this one?
Demonstrate.
No, just don't lean and stay still, okay? No, stay still. Stay still. Okay. How about this? Okay, and this one? How about this one? Can what?
Can.
Okay, that's it. And after that, let's move on to the accumulation test. So just look at this pen. Okay. Then look from afar. Wait lang. Look at this pen. Okay, then look from afar. Look from afar. And then look at this pen. Then follow the pen. Okay, that's good. The last one is I'm going to check your direct and consensual papillary reaction. So can you please hold this opaque card? And I'm going to put this in here. So I'm going to light your eye. Okay, and then the other eye. And that's it. So your eyebrows, your hair of the eyebrows is properly distributed. Your eyelashes is distributed as well properly, and the direction of the curl is outward. That means normal. And your eyelids, I inspected them, and there's no swelling or anything abnormal. And about your bulbar conjunctiva, the color is normal, the texture is normal, and the presence of lesions are, there's no presence of lesions, and there's no presence of lesions, okay? And your sclera is white, and you passed the Perla test. That means pupil equally round, reactive to light, and acclimatization. So Charisse, thank you for your participation. I really appreciate that.
Yes.
So if you want me to do something or if you need something, just tell me, okay?
Okay.
Okay, so thank you again and have a nice day.